Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Gout. Introduction. Gout is an inflammation of the joints. People with gout have intense swelling and pain in their joints. If not treated, gout attacks can become increasingly frequent and painful. With proper treatment, gout can be stopped from getting worse and the pain can be managed. This program explains how gout happens, its treatment options, and some tips for preventing it. Joints and arthritis. The human body has 206 bones that give it shape and strength. The place where two bones meet is called a joint. At the joints, the bones are covered by tissue called cartilage. Joints have a clear fluid in them called synovial fluid. This fluid lubricates the joint just like oil lubricates the engine of a car. The synovial fluid allows the joint to move smoothly without rubbing or grinding. When the tissues of a joint are injured or affected by a disease, they may swell and become red and hot, causing pain. This is known as joint inflammation or arthritis. There are more than 100 different types of arthritis. Gout is a type of arthritis. It affects 1 out of every 20 patients who have arthritis. Gout results from crystals of a substance called uric acid that deposit in the joints. The next section explains what uric acid is and how it causes gout. Causes. Purine is a chemical compound that is in all the cells of the body. As cells divide and multiply, the body continually breaks down purines and reuses its components to make new cells. Extra purine leaves the body in urine in the form of uric acid, another chemical compound. At times, there may be abnormally high levels of uric acid in the blood. This condition is called hyperuricemia. If there is a lot of uric acid in the body, crystals form. This is like pouring salt into water. A little salt will dissolve in the water, but as you add more salt, crystals form and fall to the bottom of the glass. Under a microscope, crystals of uric acid are sharp and pointy and look like little needles. In some people, uric acid crystals deposit in the joints. Uric acid crystals may also deposit under the skin, forming a lump that can sometimes be felt on the outside of the body. This is called a tophus. The immune system, the body's defense against sickness, realizes that the crystals should not be there and starts attacking them. This is what causes joint pain, swelling, and tenderness when a person has gout. Extra uric acid may also deposit in the kidneys and cause kidney stones.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Risk factors. Some people have more risk than others of developing high levels of uric acid, which leads to gout. Inherited diseases can cause high levels of uric acid. Some patients with gout have a family history. Eating too many foods that are rich in purines can cause the body to produce more uric acid. Foods that have a lot of purines include shellfish and organ meats such as liver, kidney, and brain. Dried beans, peas, and anchovies are also high in purines. Beverages sweetened with fructose or fruit sugar can also increase uric acid levels. This includes drinks made with high fructose corn syrup. Drinking too much alcohol interferes with the body's ability to get rid of extra uric acid and causes higher levels in the bloodstream. Exposure to high levels of lead tends to increase the levels of uric acid in the blood. Other medical conditions that increase the risk of developing gout include a recent injury or surgery, diabetes, heart diseases, kidney diseases, metabolic syndrome, overweight or obesity. Metabolic syndrome is diagnosed when a patient has at least 3 of the following problems: high blood sugar, high blood pressure, high triglycerides, abnormal cholesterol levels, extra abdominal fat. Some medications increase the risk of hyperuricemia or high levels of uric acid. Water pills, called diuretics, interfere with the kidney's ability to remove uric acid from the blood. This causes higher levels of uric acid in the blood. Diuretics are given to patients to treat high blood pressure and heart disease. Other medications can also increase the level of uric acid in the blood. Some examples are levodopa, which is given to patients with Parkinson's disease, and salicylates such as aspirin. Anti-rejection medications after an organ transplant can also raise your risk. Patients who are on cyclosporine are at a higher risk of developing gout. Cyclosporine is a medication typically given to patients who have received an organ transplant to prevent rejection. Symptoms and stages. Gout affects millions of people around the world. Men are slightly more likely to be affected by it than women. The first symptoms of gout are usually noticed in the early 40s. High levels of uric acid alone usually do not produce symptoms. The symptoms of gout start when uric acid crystals begin depositing in the tissues of the body, under the skin, in the joints, and in the kidneys. In many gout patients, the first symptom is pain, redness, swelling, and tenderness in the big toe. This condition is called podagra. At one point or another, podagra affects 3 out of every 4 patients who have gout. Joints that are frequently affected by gout include ankle, heels, knees, wrists, fingers, elbow. Attacks of inflammation in the joints due to gout usually last for a few days and improve on their own. As time goes by, gout attacks may become more frequent and may last longer, requiring treatment. If gout is not treated, it can become disabling and crippling. However, most patients do not reach this stage because it is typically discovered and treated early. This last stage is known as tophaceous gout. The joints can be permanently damaged, and similarly, the kidneys can also be irreversibly affected. Diagnosis. After taking a detailed medical history and doing a thorough physical examination, the healthcare provider may request a blood sample to check the level of uric acid in your blood. If a joint is inflamed when you are at the healthcare provider's office, he or she may withdraw some fluid from the joint. This is done under local anesthesia. The sample is sent to a pathologist to examine it under a microscope. If the pathologist sees no crystals in the joint fluid, the healthcare provider may surgically take out one of the tophi, or lumps, found under the skin and have it tested by a pathologist to check for uric acid crystals. X-rays, ultrasound, or CAT scans sometimes show deposits of uric acid crystals. It is important to note that most people with hyperuricemia do not develop the arthritis symptoms of gout, such as swelling, redness, pain, and tenderness. During an acute attack, the uric acid levels in the blood are not always elevated. That is why it is necessary to aspirate an affected joint or take a small piece of tophus out surgically to be examined by a pathologist. Treatment. Gout is treated with medications that relieve the pain of gout attacks, decrease joint inflammation, decrease the level of uric acid in the blood. Healthcare providers recommend acetaminophen, such as Tylenol, to relieve gout pain. Aspirin should be avoided for gout pain because it can prevent the kidneys from excreting uric acid. If gout pain is severe, your healthcare provider can prescribe more powerful pain relief medicine. There are many goals to the treatment of gout. The most important goal is to control the severe pain of gout attacks. Treatment of gout also aims at preventing more attacks and preventing the formation of new tophi and kidney stones. Medications called non-steroidal anti-inflammatory drugs, or NSAIDs, work to treat acute gout. Common side effects of NSAIDs include irritation of the gastrointestinal system, ulcers in the stomach and intestines, intestinal bleeding, severe allergic reaction. If the patient's stomach and intestines are sensitive to NSAIDs, corticosteroids can be prescribed to treat acute gout. Colchicine is another medication that is very effective in decreasing the swelling and pain and aborting an episode. This medication is more effective if taken in the first 12 hours of the onset of the attack. Medication that lowers the levels of uric acid in the blood may also be prescribed to treat gout. Some examples are allopurinol, such as Alloprim, febuxostat, Uloric, and probenecid, such as Probalin. Preventing gout. Taking steps to prevent gout attacks is as important as taking medication to treat it. The following are 5 tips for preventing gout. 1. Drink a lot of water and fluids. This helps to flush out uric acid and keeps it from depositing in the tissues. 2. Reduce weight by eating a little less and getting exercise. Do this under the supervision of a healthcare provider because a very rapid loss of weight could worsen gout. 3. Limit shellfish, poultry, fish, meat, and organ meats like liver, brain, and kidney. Low-fat dairy can be a good alternate source of protein. 4. If you drink alcohol, make sure you do not drink too much. Limit beverages made with high fructose corn syrup and other forms of fructose. 5. Take medication to reduce the level of uric acid in your blood. During a gout attack, resting and elevating the inflamed joint can relieve the pain. Applying an ice pack to the inflamed joint helps to reduce the pain also.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Gout is an inflammation of the joints. People with gout have intense swelling and pain in their joints. During a gout attack, resting and elevating the inflamed joint can relieve the pain. Applying an ice pack to the inflamed joint helps to reduce the pain also. Gout is treated with medications that relieve the pain of gout attacks, decrease joint inflammation, decrease the level of uric acid in the blood. Making dietary changes is as important as taking the prescribed medication for preventing gout attacks. If gout is not treated, it can become disabling and crippling. However, most patients do not reach this stage because it is typically discovered and treated early.
Thank you for using Explain.